Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello friends, this is Dr. Borger and welcome to episode 51 of the Aesthetic Doctor Podcast. Today, we're going to talk about radiofrequency microneedling. Yeah, it's one of those really popular procedures these days. It's actually in the top 3 right now of sort of laser or energy-based device procedures. So I figured what a perfect time to talk about it. You know, I am currently in Toronto. I'm recording this from an airport hotel, so I'm really hoping the audio to this is going to be decent. Toronto is beautiful and it's freezing. My little North Carolina self, I don't know, something happens with your blood, I think, once you live in warmer climates, that once it gets colder, everything inside of you freezes. But I'm actually giving a lecture/workshop on radiofrequency microneedling, specifically the Candela Matrix device tonight. So what a perfect day to talk to you guys all about radiofrequency microneedling. So a lot of you have probably heard of radiofrequency microneedling, or RFMN, and what it really is an energy-based microneedling. We know that what microneedling does is really kind of induce a little bit of controlled trauma into the skin, and then your skin responds by repairing itself and sort of rebuilding itself stronger, so we can, induce some collagen that way, and we can absolutely also help with the appearance of scars and fine lines and wrinkles. Radiofrequency is considered a non-ablative type of technology, where basically we want to improve both wrinkles and skin laxity by inducing or causing dermal remodeling. The reason for that is really that when we think about skin laxity, which basically is, droopy, saggy skin, that excess skin, everybody that I see in my office always points to their jawline or their jowls or under sort of their chin, or wants to pull it all back, right? So, clinically, or what we see with our eye, we see wrinkles or rhytids, and we see skin laxity. But when we look at it under a microscope or in histology, what we see is a more disorganized collagen matrix, and we see abnormal elastin. Collagen and elastin are the major structural components of the skin. So basically, if we want to reverse a lot of the laxity and wrinkles, what we want to do is restore the structural components such as collagen and elastin of the skin to their more youthful or organized kind of appearance. We use non-ablative skin techniques because really we want to achieve results with less downtime and lower risks than surgery or fully ablative lasers that, were used in the 80s and really had significant side effects, like the old CO2s. So, when we think about radiofrequency microneedling, we basically think about using heat and energy to change the components of the skin on the inside with minimal collateral damage and a low risk of complications, as well as short recovery times. What really that means clinically is all the things that you guys want, right? You want results. You don't want your whole face to be fried off and burned. You want it to be somewhat comfortable, and you want to be able to go to work the next day. And really a lot of aesthetics that is the trend. Sure, you might at some point every couple of decades or as you age have that big giant procedure, and most of us can't really or don't want to have a month off work, right? And a face that's all swollen and bruised. Instead, we take a little bit of minimal bruising, swelling for a couple of days, and we live our lives. So what does radiofrequency really do? Radiofrequency generates electric current or electromagnetic radiation, and it heats the dermis, or basically a certain layer of your skin. The depth of the heating and the duration of the heating varies with the type of delivery. What basically then happens is collagen contracts, and the contraction of the collagen will give you an immediate skin tightening, as well as the induction then of subsequent collagen remodeling. So that's why a lot of times when people get those procedures, that's exactly what they see. You see that immediate effect where you get that skin to be tightened, but then over the next couple months, you see true collagen remodeling that we could even see on histology slides, meaning if we cut out a piece of your skin and looked under the microscope. And, in a lot of these studies, they actually, as part of the follow-up, did punch biopsies. Of course, with radiofrequency microneedling, other than just getting the radiofrequency, you're also getting the microneedling trauma, which will also help kind of induce the upper layers of your skin to remodel and heal. So people do see that same like microneedling glow as they get a little bit of turnover and scabbing. Radiofrequency microneedling, what's really cool is that the electrodes are inserted into the skin, right? It's not just inserting electrodes. What we really do is we target the depth. And then the electrodes on the microneedles are able to deliver the radiofrequency at certain depth. Meaning that not only does the radiofrequency in some other procedures get delivered to the outer layers of the skin, but then, of course, if we end up having more laxity or deeper tissues, like, for example, around the jawline, in the neck. I mean, who after a certain age does not want their neck to look amazing? We can insert the microneedles deeper and then from there deliver the radiofrequency deeper. So what radiofrequency microneedling has really done over traditional radiofrequency that was just applied to the outside of the skin is to increase the efficacy and to increase how good the results are, simply because we are delivering the radiofrequency at exactly the depth that we want. Now, you might have heard that there is different types of radiofrequency microneedling, and we in our office actually have different types of devices. So we do have a long pulse device. There's only currently one long pulse device on the market, which is the Profound by Candela. And what long pulse really does is that you can deliver more than 1 second of radiofrequency pulses, and you can do it at deeper depth. So the reason it's a one treatment, and in a study it has shown 100% of patients to have some degree of improvement. Of course, patient selection is always really important, right? We're not going to get a full facelift, but you're going to get totally some improvement in tightening. But what it really does, what makes it so unique, is that it can deliver radiofrequency that it monitors and holds over time at a much deeper depth than we would use with our regular short pulse ones. So you're going to get amazing results in a single treatment, and that's profound. Now, all of the other radiofrequency microneedling devices on the market are considered short pulse, meaning you're getting less than 1 second of radiofrequency energy. What that really means is that it's better tolerated. We're not going to need as much numbing. And it's a more like low downtime in-office procedure. You're going to need multiple treatments, and you can still get amazing results with multiple treatments. And it's more of an option for, let's say, more people. And then also, with a long pulse radiofrequency microneedling, we can only currently treat like the lower face and neck, as well as some cellulite and some body indications. While with the short pulse, especially the matrix treatment that we have right now, like we can do under eye bags or festoons, we can do eyebrow lifts, we do a full treatment that starts at your hairline and the forehead and goes all the way down to your neck, because at the different types of tissue in your face, we can just really reset the depth that we want our needles to penetrate. So let's, of course, say around the eyes or your crow's feet, we're going to do a very, very superficial treatment because the skin is a lot thinner there. But then, once we get to the jawline, once we get to the jowls, once we get to under your chin, if there's more tissue, we can go a lot deeper. The other thing that you might have heard of is that there's monopolar, bipolar, tripolar, et cetera, radiofrequency. And I think unless you're super into science, that I'm not going to get into exactly the specifics of all of that. But what it really means is just how many electrodes you have current flowing between. And it also helps, or it changes how much you can control the energy distribution as well as the depth of penetration. The other thing that you might have heard that happens with bipolar radiofrequency devices is that there's fractional bipolar radiofrequency devices, such as the sublative device that we have on our platform, where you basically get a little bit of ablation coagulation of the skin. And so it's not technically non-ablative, but you're basically getting some ablative treatment of the skin, or some almost like remodeling of the outside of the skin combined with some radiofrequency. I mean, microneedling radiofrequency, I think, is kind of like the it girl of now. It's the Taylor Swift of today, where everybody wants to have a device. Most people have had a treatment. And let's talk about also who's like a good candidate now that we're done with a lot of the science, right? With these treatments, first of all, as your collagen decreases starting at age 25, lots of people are great candidates, even if they're younger, because again, inside of your skin, when we look at it under the microscope, that slide has already started. You just haven't seen it yet. So as we want to rejuvenate, as we want to prevent, as we want to preserve, there is really, I think, no age limit. I was actually part of one of the research studies for the Profound Matrix, the clinical trials. And what was kind of amazing was that we treated patients all the way from their 20s to their like mid to late 70s, and they all got results. Again, if we're, let's say, saying your wrinkles are going to get a certain percentage better, when you're 76, it's unrealistic to think that you're going to have a non-surgical treatment and end up with no wrinkles. But everybody was happy with the treatment. At least in the Matrix, we treated patients with all skin types, all ages, all ethnicities, including people of Asian descent, including Caucasian or white people, including Hispanic or Latina patients, including several African American patients, including everybody, right? And we had no significant side effects. We actually had no hyperpigmentation. In fact, most of everybody saw not only the skin tightening, but saw a brightening. and a lightening of the skin. So that was, especially the brightening and the lightening, was one of the things that surprised me a little bit, because in other devices, there had been a risk of almost hyperpigmentation that I know people with darker skin types always have to worry about. But with the Matrix, what we actually instead got was brightening and lightening, which everybody was super happy about, because who does not want brighter, more radiant skin? And let me tell you kind of why I think that is. What makes the Matrix unique is that it has the thinnest array of microneedles on the market. So it actually has, when we look at the surface penetration in terms of millimeters and especially surface area, some of the other ones have over a 200% greater surface area when you think about, you go from like 0.1, 0.2 millimeter needle to like something bigger, and you do the math. Also, it makes it a lot more comfortable. And the other thing is it's a titanium needle versus a gold needle. So if anybody has a gold silver allergy, they're not gonna react. And we know that inflammation is also what causes hyperpigmentation. So what else do I want to tell you about? And I think, what I'm going to tell you about is really a little bit what we love about our devices. We, of course, have the Profound from Candela, which is the only long-range radiofrequency microneedling on the market. And I think that's the one, if you really want a one-and-done big treatment, if you want to see these significant tightening results, if you want to treat cellulite, it's amazing for cellulite. And knowing that you're going to have to get numbing stuff injected in you, because it is deep and we are able to heat your tissue actually over several seconds to a temperature of over 60 something degrees Celsius. So you're going to need numbing, topical and injected. It's a bigger procedure. Some people have said it's like a non-surgical facelift. I don't ever want to promise facelift-like results, but the results are quite impressive, and it also helps with cellulite. As I said, short range is really what everybody else has and what we have as well, and we absolutely love the Matrix by Candela. Again, I was part of the study, so am I biased? Maybe. And though I also have the background information, and I have the information that really objectively measured improvement and that objectively looked at outcomes. So what also makes that device special, and I think this is really the newest in radiofrequency microneedling, is the fact that it has, both depth and sort of impedance intelligence. So as far as it being the newest, what makes that device, the Matrix, unique is that we can now stack 3 pulses. So in competitors' devices, what you have to do is do multiple passes, right? So they have thicker needles. Of course, you do multiple passes. Number 1, it takes longer. Number 2, it's less comfortable. And then number 3, actually, once you've already done your first pass, you're getting more edema and more swelling. So inside of the tissues, the energy deliverance and the energy sort of impedance that the pulse goes through is already altered, meaning your first insertion is your best insertion. That's basically what that means, because you're not already getting the tissue edema and all that stuff. And most people will just do 1 pass per treatment and then do another pass in the next treatment. But what the Matrix does, which is really amazing in terms of the depth and the intelligence, is that, let's say, of course, I'm in deeper tissue, right? Because I need space to do this. I'm in your jawline or in your jowls where you think you have some extra tissue. I can go really deep and deliver a pulse. The needle itself, instead of pulling itself all the way out, in the span of a millisecond, this obviously happens because it's, computer controlled and I have just set my settings. It pulls itself back to, let's say, halfway, delivers another pulse, pulls itself back a little, delivers another pulse, and then pulls itself all the way out. And this happens so fast that other than hearing some beeps, you don't even know it's happening. So what that means now, instead of getting one insertion with one delivery of radiofrequency, we're now getting one insertion with 3 deliveries of radiofrequency. Can you see why this is absolutely a advancement in technology and something that makes it really amazing? Because instead of now having to do 3 different treatments or 3 passes, which really with the other devices, I don't think anybody does 3 passes, we can now do 1 insertion and get up to 3 pulses. Now, of course, in tissues where we don't have the depth, like above your eyes when we're doing an eyebrow lift, we're going to do 1 pulse or maybe 2 pulses because you need the depth. But in tissues where really the laxity happens, which, as I said, it's the neck, it's the jawline, it's the lower cheeks, it's the chin, like, you know where you guys are lax. Everybody always like tries to pull their face back. We can do up to 3 pulses. And it does real-time impedance monitoring, which I don't know very many, if any of their competitors do, where instead of, and this is the part that I kind of skipped over, instead of just blasting out energy into the universe and you not knowing what you're getting, it measures impedance over time. So it senses what comes between the electrodes and it adjusts how much energy it delivers by looking at how much energy you actually get, which is amazing because it really measures the results versus just measuring what it sends out into the universe. The Big Profound does that too over time, but as far as short range goes, that's absolutely amazing. And then, so both the device and your practitioner know exactly what it is that you're getting for better results. And then, like we've already mentioned, it has the smallest microneedles on the market, and the results are just amazing. So other than being part of the study, I completely believe in the advancements of the technology of that device. Now, if you're not somewhere where you can get that, if you have a different device, radiofrequency microneedling, like I started in this presentation, really kind of works. Of course, there is slight differences in technology. There is slight differences in settings. There is, as always, how well trained is the staff that treats you in the settings that they set, right? How well trained are they in the technique? And so it's all like always a mix of all of the above. It's a mix of your skin, are you the great candidate, as well as then what device do they have? Because anytime we use energy-based devices, the device that you get treated with absolutely matters 100% because that is the technology. And then also, your practitioner, how well trained are they in using the device? How well trained are they in doing the right insertions and doing the right settings and doing the right treatment protocols? Anyway, this is radiofrequency microneedling. As I said, it's the it girl of today. It's the Taylor Swift era's kind of like treatment of today. And I think with good reason, because as we have learned more about aging, I think we really find that if we can improve somebody's quality of collagen and elastin in their skin, we're getting away from chasing every single wrinkle. And after a while, you just can't chase every single wrinkle. So, you can absolutely use these devices both when you're already seeing signs of aging or, we love prevention because as we know, at 25, your collagen starts to go down. So if you're 25 or older, boost that collagen curve back up. And that's also sort of an important thing to know, is people are always like, how long does it last? And that's an interesting question because it's not like we inject a Botox and a filler and we can really kind of measure when that clinically is gone. What I think about it is that you all have like a collagen curve, right? And that collagen naturally depletes over time. And then of course there's things also you do to deplete it faster, like sun damage, like smoking, like all of these other things we've talked about. So what these devices do is they kind of bump you back up on that curve, and then aging continues to progress. But really what we want to do is continuously get bumped up, and then of course you can combine it with other things that keep bumping you up and keep bumping you up. But radiofrequency microneedling, definitely here to stay. Could give you some great results with minimal downtime, and especially in the case of the matrix, what's also amazing about this is that it's a very inclusive treatment. Any skin type, any age, any gender, anything, this treatment is applicable for, and I really, really love that. So this is the last episode before New Year's, you guys. I love finishing this way. As I said, hello from Toronto. I'm getting to lecture on radiofrequency microneedling tonight, so it's all fresh in my mind. And it's, you guys know I love technology. You know I love research. You know I love evidence-based stuff, and you know I love safe stuff. So radiofrequency microneedling is all that. As we head into 2024, I just wish you all the most glorious, wonderful, and abundant year. If there's anything I can do to make or help you, co-create with you, work with you to make your lives and your businesses more authentic and beautiful, I'm always, always here for you, and I love to hear from you. So I wish you a happy, happy new year. I'm sending you all my love, and I can't wait to see you for the next episode. Bye-bye.
Thank you for listening to the Aesthetic Doctor Podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger, and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.